Why not disclose doctors who have been disciplined?
Well, as I said, we follow federal regulations.
If they're outside the military system, they can look up whatever they want. If they're inside your circle, they can't do that. Does that feel right?
As a surgeon, what feels right to me is having a conversation with my patient. This piece about transparency is near and dear to my heart. Being transparent with the patients, we can certainly think through, not that more can't be done necessarily, but I think we've been very forthcoming with respect to the information that we have made available to the patients. But
it's not specific. It's statistics, it's policies.
Yes.
It's not something that can help me at the ground level make an informed decision about my health care. And so to circle back, to answer those people who say that they haven't gotten the information that would satisfy them, how do you respond to that?
I respond that these kinds of events are heartbreaking. To the extent that we can be transparent with our patients, we should be, and I believe that we are.
Courts pointed to agency and third-party websites that detail ratings, patient survey results, and statistics related to harm and deaths at specific military facilities and clinics. But we found the agency's Transparency Hub is hardly transparent, with no data found about adverse events at some locations and outdated news releases, reports, and policies on their homepage. The most recent post highlights high safety grades given to just 9 military hospitals, something courts cited during our interview, along with consistent recognition for a handful of facilities by the American College of Surgeons. But when pressed about the basic data we obtained about providers on the other end of the spectrum, those involved in discipline, he was far more elusive.
Give me an idea of the percentage of physicians and providers in the military healthcare system that are having these adverse privileging actions, this discipline taken against them.
Yes, let me give you some perspective on the size of our healthcare system.
I just want your perspective on the actual number of physicians and providers being reported to this data bank. Is it satisfactory to you to have 500 doctors or providers reported in that small window of time?
Josie, we have multiple sources of information about the safety and quality of our care.
To you, does that seem like a low number? Is that a high number? What does that amount of reporting say about the quality of the military healthcare system?
We deliver excellent, safe, high-quality care.
Court says the goal is zero harm, something he says the DHA tries to achieve through root cause analysis, looking at what went wrong in serious injuries and deaths, using data to look for trends system-wide, and then creating policies designed to improve healthcare quality overall.
We insist on high-quality, safe care, and so we will continue to deliver on that promise. Our patients deserve it. I'm one of them. Whether I was one of them or not, they deserve the highest quality, safest care that can be delivered anywhere in the world. And that's my commitment and our commitment to make that happen.
A pledge to those who put their lives on the line and their families. People who've told us the military system they trust with their health continues to put secrecy above those who serve.
And the Defense Health Agency says it supplies disciplinary action to that confidential government data bank and state medical boards as required, just like private hospitals, and that it's up to state boards to decide whether it's made public from there. For now, we are going to leave you with a live look from our Mount Bigelow cam where the sun is going down, but hey, it's still pretty bright out there, I would say. Hope you all are having a great start to your week, and we hope you will join us for 13 News Live at 10 for more of your news and weather. Have a great night.